سلام
سلام
خانم دکتر انگلیسی صحبت کنیم. Okay. So we're going to go in English over here now. Endometriosis Australia community. We're here at the Asia Cup and I'm joined by the magnificent Dr. Shamsa, who is a specialist in diagnosing ultrasound-based endometriosis. So we're going to talk a whole lot of things about endometriosis over here. So Aiat, maybe tell me a little bit about your journey first. How did you come to be here?
So being here, well, I'm an obstetrician and gynecologist and I, like you said, specialize in women's imaging and I work as a specialized women's imaging place where we diagnose endometriosis frequently. So I think, and part of my work is trying to help improve earlier recognition of things like endometriosis and validating the pain. And spaces like this at sport is important because girls can't thrive in sport if they're in pain, if pain is sidelining them. And it's important to have raising the awareness in these spaces actually helps these young girls to recognize that they don't have to push through the pain and you shouldn't have to just put up with it.
That is such a true story, isn't it, really?
Yeah.
And I think we see that all the time, particularly with endometriosis. Tell me, we're here now at the Asia Cup, and in particular here we have the Iranian team here. And of course that resonates a little bit for you and me over here as well.
Yes.
And we have at Endometriosis Australia released a whole lot of pamphlets in lots and lots of different languages addressing things such as endometriosis and periods, particularly also in Farsi. Tell me, what does that mean for someone who is potentially culturally, linguistically isolated? Does that type of information help?
Yeah. So I think having information, particularly health information in one single language sometimes can unintentionally exclude some communities, and having health information and those resources in different languages mean that those people in those communities actually have more recognition of their own symptoms, of their problems, and more likely to seek help. Because language isn't just a translation. Language is access, and a better access means better health outcomes. So it's great that we have different languages available now.
And that goes for so many things, doesn't it? It's language is more than just the words. It's also the cultural context, and those sort of things are really, really important as we're particularly dealing also with communities in Australia, and rural and remote communities.
Removing
where
that
it's
barrier.
different.
Yeah, absolutely.
Tell me, what would you say to, we're here now at the Asia Cup and we're about to watch the Matildas and the team from Iran play over here. What impact do conditions like endometriosis have on athletes? What would you say to women struggling in this situation with periods and with period pain?
So what I would say to a girl who has endometriosis and pelvic pain is, if you love sport, if you love soccer, pain shouldn't be something that you give it up for. You have to know that there is help out there. There is answers to your questions. There is treatments for your symptoms, and there is people who can and want to help you. You just have to speak up. And missing out on your trainings or missing out on sport events is a signal, and you deserve for that to be taken seriously.
Up until now, one of the barriers has always been that the diagnosis of endometriosis has relied on that histology and on laparoscopy. So tell me, what's changed recently?
Well,
and this is of course your field.
Yeah, so with my passion and my field, I believe a lot of types, and not all of them, can be diagnosed on ultrasound. Part of my work as a clinician and in the imaging space is diagnosing endometriosis frequently. And yes, diagnosis needs careful listening and clinical expertise, and it needs specialized imaging. But what I've also learned is diagnosis can also be treatment for itself. It may not treat the physical symptoms, but diagnosis can sometimes help the emotional symptoms, the emotional pain.
Validation.
The emotional pain, yeah. So the validation helps the emotional pain that comes from being dismissed, from the self-doubt. Is this all in my head? It's not. And that, having a name for your pain helps to actually recognize it's real. And that's when you can advocate for your own health.
So true, so true. And so tell me, we have been talking about specialised centres for diagnosis of endometriosis with ultrasound. Do you have to have access to a specialised centre in order to be able to make a diagnosis of ultrasound, through ultrasound?
Well, at the moment, because we have better access in terms of, our PBS covering for specialised imaging for endometriosis, if your referrer is concerned that you have endometriosis and they state that, then you have a different, Medicare item number that can be done. But most importantly, the awareness is not also just in the community, it's also in the medical space. And that actually helps train a lot of sonographers, a lot of specialists to actually be able to interpret the imaging and give the diagnosis to actually help with starting that journey and getting the girls in the right path for the diagnosis and then treatment.
So many families tell us that they don't know how to talk about menstrual pain or how to worry.
Yeah.
What is your advice to that?
So I think in those situations, particularly teachers, coaches, people outside of the immediate family can be a lot of help. Those guys are usually the adults who recognize the pattern first. They see the girls sitting out of training, they see the girls missing out on things. And it's important if they create spaces, create that safe environment for them to be able to speak about menstrual health openly. And that's when they, become comfortable and believe themselves, and then they can speak up and sort of, seek the help they need.
I think that's very true. I hear them chanting in there, so I think it's time for us to go. Who are you going to be rooting for here today?
Don't ask a political question. I'm split. I'm going to be half-half.
Aren't we all?
Yeah.
So thank you for joining us over here, Aiat. Thank you to Endometriosis Australia for hosting us over here. And go to Tilly's!
Woo!